Let's think of WA's health system as a puzzle. There are multiple pieces that make up the whole picture, each part fitting together and playing a role. There are key pieces like adequate staffing, maintaining infrastructure, and upgrading existing hospitals. And there are trickier ones, like catering for WA's ageing population. Every day, there are hundreds of hospital beds filled with people waiting for aged and home care places. The government is confident the health puzzle is largely put together. It's got a women's and babies hospital in Murdoch on the way. It's continuing to push the federal government for more home care packages to get older West Australians out of EDs. And it's freed up $500 million for a health infrastructure fund to dip in and out of. But some on the front lines say there are still missing pieces. ED doctors want another hospital in 7 years, but the government won't put a timeline on it.
I can't say that we're going to do this in this specific period of time, but as you know, the health department is always looking at these planning and forward projections of demand.
Instead, it's putting out a short-term fire, another record month of ambulance ramping.
It is an embarrassment for this government. They should be ashamed and they should be humiliated.
The government blames a severe flu season and aged care shortage, but the health puzzle is only going to get more challenging as new issues arise. Few people understand the system like former WA Health Director General and Child and Adolescent Health Service Chairman Dr Neale Fong. He brings more than 35 years' experience in both the public and private sectors. Dr Neale Fong, welcome to Stateline.
Pleasure to be here.
What are the missing pieces of WA's health puzzle?
Well, if you put it as a jigsaw, you know, there are edges and there are centrepieces and there's always that last missing piece. I think we're a fair way off from finding the last missing piece to kind of complete the picture.
WA recorded its third back-to-back month of record ambulance ramping this week. Why is it continuing to get worse?
Well, I think the needs of our population continue to grow. Our population itself continues to grow. More people and an older population, as many people have said over and over, means that there'll be more demands on our healthcare system.
Health unions have put forward a 5-point plan to address ramping. Do you think this approach would work?
I think that it said they needed more aged care beds, and everyone's been saying that, but you can't just conjure them up, you know, out of thin air. They take time and money to build and to find, and then obviously staff.
You're leading a snap review into WA's hospital infrastructure. What have you found so far?
Well, I found that all of the health services are trying their very hardest to ensure that the facilities that people use are at a standard, and they are at the standards. But are they old and depleted in some spaces, like we've heard about at Royal Perth and Charles Gardner? Yes, of course. So we have found that there needs to be more effort and probably more resources, importantly, put into the repairs and maintenance of our ageing hospital stock in particular.
If we need more capacity, why can't we just build a new hospital right now?
Well, I've said this for many years now. It's not just about hospitals. We need to be investing. Yes, there may well need to be more hospital beds, but we need more support services in the earlier parts of people's illness trajectory. So, you know, in terms of maintaining people with diabetes so that they don't get the complications of diabetes, therefore don't need a hospital bed. And some of that may be as simple as providing, you know, home care, nursing and support to those type of people. The mental health space is the other one where we need to employ more into the social work side of looking after people in the community, and so that doesn't impact emergency departments. So it's not always about beds.
You've started this week in your new role as Chairman of the Child and Adolescent Health Service. What's your priority?
Well, we have a fantastic children's and adolescent health service here in Western Australia. It has been under pressure with a number of issues that the community would be aware of. We've got staff that are very committed. We've got great research that happens at the Child and Adolescent Health Service. You've
been described as a health fixer. Have you been brought in to do just that?
No, I don't believe so. I don't believe the Child and Adolescent Health Service is broken in any sense. I think they've had troubles, as you want to call it like that, and I think it's a matter of, you know, it's a good service. I love the analogy of going from good to great, but in terms of the health service itself, no, I haven't come in to fix it. I've come in to help work with all of the staff, the doctors and families for that matter, take it to its next phase.
Dr. Neale Fong, thank you so much for your time.
It's my pleasure. Thanks for having me.